Yep, we're ready. This looks weird.
Okay, sounds good. I'm gonna go ahead and share my screen. I have a couple of slides prepared. Alrighty, so thank you again for having me today. I am so honored to be your guest presenter at your Better Breathers Club. I know several people that do join the Better Breathers Club meetings throughout the country from our captain's program. It sounds like a really great group of people, and I'm really thrilled to be able to come and speak with you all, even though I'm very far away from you. So thank you, and I'm here from the COPD Foundation to tell you a little bit about our community, the advocacy work that we do, and the resources that the COPD Foundation offers the community. My slide doesn't want to go forward. There we go. So, as I said, I am from the COPD Foundation. For those of you who aren't aware, the COPD Foundation is a nonprofit, and as I mentioned, we are remote and we're throughout the entire country, but we are actually an international nonprofit, as we have some staff members from countries outside of the United States, and we do a lot of work with people from outside of the United States as well. Most of us are based in the US and a lot of our resources are based in the US, but we do have a lot of resources on our website that are translated into different languages. We have captains in our program that are outside of the United States, so it's just a really great center for all of these resources to come together and to help the lung health community. Our mission is to help millions of people live longer lives by advancing research, advocacy, and awareness to stop COPD, bronchiectasis, and NTM lung disease. So we do not just focus on COPD, we also have a bronchiectasis and NTM section of the organization that does exactly what the COPD Foundation does in the education, research, and advocacy space, but focusing on bronchiectasis and NTM lung disease, which is another form of chronic lung disease, but just operates a little bit differently than COPD. There is overlap between COPD and bronchiectasis and NTM, but they're not the same disease. At the foundation, our team performs research. We have educational resources for the public to provide education to patients, caregivers, and the professional world. And we also do advocacy for policies that will make life better for those affected by chronic lung disease. And here at the bottom of the slide, I just included a screenshot of our two different websites. We have a website for the COPD Foundation, and we have a website for the Bronchiectasis and NTM 360 initiative. So if you are affected by either COPD and or bronchiectasis, you have two different wonderful platforms for you to visit. Find my little arrow down here. There we go. So I've been with the foundation for almost 3 years now, and I absolutely love working for the foundation. I love so much about what we do for the lung health community and what we offer people who are looking for answers, whether they be patients, caregivers, loved ones, healthcare providers, or just people who are interested in learning more about the disease. So I could go on and on about all the things that make our foundation great, but what I think makes us special and what I think is just what makes me proud to serve the foundation is that the foundation serves as a space for the lung health community to gather and share experiences and connect with each other when people are going through what might be a difficult time with their lung disease. So at the foundation, we offer a lot to the patient community specifically. We have monthly support group meetings. So we have a monthly meeting for COPD. We have a monthly meeting for bronchiectasis and NTM. We have a monthly meeting for our program called Harmonicas for Health. You can see this awesome still from a video here. And this is, it's a support group, but it's also like a special interest group where people have harmonicas and we have sheet music and you learn to play the harmonica and we learn songs and play them together because the harmonica is a fantastic way to exercise your lungs. And this is a still from a video that some of our Harmonicas for Health patients did that was actually played as a national anthem for a minor league baseball game this past summer. It's just, you can find this video on YouTube. It is just so cool. I really love the opportunity that the foundation provides for the lung health community to come together and do these kinds of activities together. And then we also have a monthly support group for those who use supplemental oxygen called OxyTalk. Something else cool that the foundation offers is a dedicated social media platform for both bronchiectasis, NTM, and COPD. I included a screenshot up here. I don't know how well you can see it, but this is just a screenshot of the COPD forum that we have for COPD 360 Social. And it is a space, it's not exclusive to anyone, it is COPD focused. So we do have a lot of COPD patients come on and ask questions and share their experiences and share how they're feeling today. But then they also share just, you know, sweet pictures and pictures of their backyard and recipes and pictures of their pets. Here we have Debbie wishing everyone a thankful Thursday with this adorable picture of Snoopy. And then above, we have Jasmine asking a question about, can emotions cause a temporary flare-up or asthma attack? So this is a great example of a platform for a community to come together, but for people to really use it however they find to be the most helpful. We have over 60,000 members on our COPD-focused social media platform, and we have over 5,000 members on our bronchiectasis and NTM-focused platform. And you can find both of these platforms on the COPD and bronchiectasis websites. We also have at the COPD Foundation our team of peer health coaches, which are individuals who have chronic lung disease or their loved ones or caregivers that are on our staff that are the people who answer the phone when you call into the foundation or answer their emails when you email the foundation. And if you email the foundation or call us with a question about pulmonologists in your area or looking for resources to address your specific type of lung disease, they have all these resources that they are there to help you with. Afterwards as well. Okay, Audrey says that I can send this presentation out afterwards. That would be great. And then at the foundation, we also have a slew of patient resources. And I think that this is one of the most useful things that we have at the foundation that patients are able to access when you go to our website. Alrighty, so I know it's hard to read from your end, so I can go through this relatively quickly. So here is just a screenshot from the COPD Foundation website. We have a Learn More tab when you go to the website, and you don't need to read all the fine print, but as you can see, we have a ton of information, and all of these leads to a page with additional information to share for you. So we have a section for people who are newly diagnosed with COPD, caregivers, healthcare providers, people with COPD pneumonia, oxygen therapy, pulmonary rehab, educational materials, the Pocket Consultant Guide, which we'll learn about here in a second, and then about how we educate and support. This is just a screenshot of, if you click on the downloads library, this is the top of the page that pops up. And we have dozens of free resources that you can download, like Basics of COPD, COPD 101, disaster preparedness plans. All of these are available for free on our website. Next, I wanted to tell you guys about the Pocket Consultant Guide, which is an app that the COPD offers for free that can allow you to kind of track your COPD and manage your medications better. So I have two quick videos to show you all. The first is how the Pocket Consultant Guide came to be. I'm going to go ahead and play it. Let me know if you can't hear it. It should work well. We tested it.
Quite a while ago, when we felt we wanted to give, especially healthcare professionals, something simple that explained how you could approach COPD diagnosis and management, but to do it and give them tools, practical things. So this is how it started, a laminated app, or it is a pocket guide, not an app, a laminated pocket guide. This is one side of it. You can see there's the algorithm for how do you approach therapy. There's the MMRC, which is the scale about breathlessness. There is the COPD assessment test, which is the CAT. And for us old timers, this was great. But younger people wanted something else. Go to the next slide, please. You can see this is the other three panels that were on it. And this is all the medications, and there's a brand name version and a generic name, because many times when we're presenting to healthcare professionals, they need us to use generic. And this was great, but as I said, a lot of our younger colleagues thought we needed more. Next slide, please. So what we did was develop an app for healthcare professionals. And this is just some of the screens from that app. The one in the center is the home screen. The one on your right is the other things that you can see besides what's on the home screen. And this was really very well received, but it wasn't enough. Next slide, please. What we needed to realize was something that was specifically for patients and caregivers that would have some different things on it, as you can see on the picture there. This was not all on the healthcare professional app. There are several of these that are specifically for patients and caregivers. Now this app can be used on iPhones and Androids and smartphones as well as on tablets. So it gives us lots of flexibility.
All right, so that's just a little bit about how the app can be. I see Audrey running, presumably to mess with the volume control. So that is just a little bit about where we came from with the Pocket Consultant Guide app. Oh gosh, it's gonna make me get out of here before I go to the next video. So here is what I think is a great video about how you can use the Pocket Consultant Guide. This is just one faction of the Pocket Consultant Guide about how to use my COPD action plan. I'm gonna go ahead and let you all see this. I also know that I think Audrey is familiar with the Pocket Consultant Guide. So after this video plays, Audrey, I would welcome you to share anything about this. If you choose, you don't have to. We'll go ahead and see how we can use the Pocket Consultant Guide to help keep track of our health and share this with our healthcare providers.
Let's go to my COPD action plan, please. This is another, I think, really important way to do the track. Now, this one is for daily tracking, and you probably want to keep track of it pretty much every day, and I'll show you why in just a second. But you get to choose what kind of a day it is. And we'll just go down through these before I click on, or ask you to click on them. You can see normal. Everything is pretty normal activity, eating. Then a bad day, you have a fever, you're using more medication, you have more mucus, you're more tired, you have ankle swelling, more breathlessness, or you're catching a cold. You can check any of those. Or if it's a really bad day and you need help right away, and sometimes this is where the caregiver can help too. I'm confused. you may not be able to support to use the app, but your caregiver can. You have shortness of breath, severe shortness of breath or chest pain. You have blue color around your fingers or lips, or you're coughing up blood. Now, you get to choose every single day. Let's say that I am more tired than normal or have trouble sleeping, and I'm more breathless than normal. If you can check those for me, Vinny, that's great. Okay, now you're going to see next to you. You're going to see what kind of actions you want to think about. You're going to limit your activity and maybe use circular breathing. You're going to take your regular medication. You're going to report these changes to your doctor. And you may start special medications that have been prearranged with your doctor. But I like this because it doesn't have you just say, well, it's not such a good day. It actually gives you the kinds of things that you should do. And if you've got a caregiver with you who may not be as familiar as you are, this really can help them. Let's go back now, Vinny, and let's check one of the things in the really bad day box, if you can, please. Let's say I have blue color around my list of fingers. And then go to next, please. Call 911 right away and start the medication. This is truly an emergency situation. And I think having this, especially for your caregiver, if they're a little nervous about this, or you, if you need permission, it helps you really need to do something immediately, not sit around and see if it doesn't get better. So that's what you can see as your action plan. Now let me show you how this is kept track of overall. So let's go back to home and go to the calendar page. Okay, can we see a whole bigger calendar? There we go, thanks. All right. Vinny very nicely kept track of pretty much every day in October. And if this, let's pretend this is November and I'm in for my doctor's office, I can show them what happened over the entire month. And I think this is really important because it gives you a picture. If you can look at this, you and whoever you're seeing can understand that most of the days were green. There were, what, 5 to 6 days.
In March, we're going to
bad
have some
ones,
medical
but they
students
didn't
come and
have
talk.
multiple bad
In
ones.
March, we're going to
in a
have some
row.
medical students come and talk
And
about
this is
talking to your healthcare provider and having data like this where you know how many days are good or bad or whatever.
an
It's really
idea
helpful
of
for
how
them.
things are
So
over
this
the
app
whole
is
month.
really good
Now,
at that.
I would like to say that this is kind of like what we call a hemoglobin A1C for diabetes. Those of you who are outside, you know, that we can draw a blood test and it tells you how you've done over the last almost 3 months. But this is, I think, one of the first times we've had a good base report what happened over the last month, or it could be 2 months or 3 months, and take it in and share it. And if your doctor needed to know what any one of those days meant, you can check that and see what that was right on the bottom. So if we clicked on the 14th, Benny, I think it would show us what that day was. Yeah, it would say, see, that day I was confused, just blurring my speech. And what I did that day was start my special medicine. And so it lets you really know what's going on the calendar. Let's go back to home now.
Alrighty.
I could just see where you put it.
Figure out how to get out of here. So that was a wonderful overview about how the Pocket Consultant Guide operates. I am going to pause to give Audrey a chance to speak about it because I believe she uses it. And Audrey, if you don't need a moment to speak, just send me a text and I'll keep on keeping on.
I really like the app, and I put a flyer in whenever I talk to patients in the hospital to download the app because I think it does help you to track that data. You can then show your doctor and say, how well have you how have you been over the last year, because you haven't seen your pulmonologist in a year. So then you can say, well, most of the time I've been great if you're feeling great that day, but you can look back and see, well, maybe I actually was yellow more than I thought. So I like it a lot. I think it's a great app. And if anybody wants help downloading it, I can help you.
How long have you been using it?
Probably like 2 years.
All right, thank you, Audrey, and thank you all for sitting through our videos.
I told you about
worked
it.
well on your
I
end.
know I told you that.
Next up, I want to talk about another faction of the COPD Foundation, and this is one that is very special to me. This is our captain's program. So as the Senior Manager of Advocacy and Public Policy, one of my responsibilities at the foundation is to be our captain's program coordinator. And this is how I know Audrey and Kathleen. So we have met to join the captain's program, which is the COPD Foundation's volunteer arm, and it's made up of patients with COPD and other lung health conditions, their caregivers, friends, families, and loved ones, and healthcare providers who volunteer their time, resources, and expertise to serve as community leaders alongside the foundation. Our captains spread awareness of COPD in their state and local areas. They mentor fellow COPD community members, and they participate in grassroots advocacy and community building activities. The captain's program is mostly virtual. As I mentioned, here at the foundation, we are an international program and we do a lot of things remotely, but we do have in-person advocacy opportunities like Impact, which is something that we'll talk about later in our presentation. We have almost 200 captains in our program. You can see over here, I know it's probably hard to see on your end, but this is a screenshot of one of our monthly captains meetings. Here is Audrey right here. We also have Emily, who some of you may know. I believe Audrey works with her. Here's me. Here's a lot of our other captains. And we just meet monthly to share updates about the advocacy opportunities here at the foundation, share experiences with how our advocacy and awareness opportunities have been going, and then talk about just things that are going on in our communities that we can assist with and help spread awareness of COPD. We also have monthly newsletters that go out the week after our captain's meetings, and we have lots of opportunities for FaceTime and other community events, both virtually and over social media or in your own community. Let me see. This PowerPoint is really giving me the what for today. We'll continue to talk about advocacy and how we advocate for lung health here at the foundation. I'll go ahead and pause and let Audrey share a little bit about the captain's program. She is one of our rock star captains. She attends every meeting. She does all of the action alerts that we ask her to. She attended Impact. Audrey, please feel free to share a little bit if you would like. And our newest member, Kathleen, just joined us at the captain's program. You two are welcome to chat a little bit about it with the group if you'd like. If not, no big deal. Just shoot me a text when you're done and I can move on.
Okay, so I'm just telling her that we will talk. So the captain's program is voluntary, and the meetings are once a month online. They're at 3 p.m. the first Tuesday. So if you guys are interested in, doing some advocacy work, you can always kind of sit in and watch one of the meetings. It's completely remote because everybody in here is throughout the whole country. So like she's in Minnesota, he's in Illinois, she's in Florida. Northern Florida, they're all over the place. That's Tara. She's usually here. She's on MI as well. And then what they send you to do if you are wanting to get involved is they'll send out emails with action alerts, which means if there is a bill that they're looking to pass in Congress that's promoting lung health, that it's a pre-written letter of what the bill means, and then there's a little part where you can say, you know, what it means to you and why you think that our elected congresspeople should support it. So they'll send that to you. It takes 5 minutes because you can just say, my name's Audrey and I think lung health is great, and send it off. And every time they get a letter, they, it just puts that in front of their eyes one more time. So that the few that we've had, I think there's 4 last action alerts from last year. One was the SOAR Act. So that's supplemental oxygen access reform. So making sure that everybody has access to oxygen and access to a respiratory therapist for questions about their oxygen. Because as of right now, most people, it's just a delivery. They call it the Amazon model. So they just deliver it to your house and you don't always have a respiratory therapist to ask questions. And then the virtual pulmonary rehab would support having pulmonary rehab via telehealth. If you can't get to, our clinic, then that's really great. And then the PASTEUR Act is to help with antimicrobial resistance and funding that. And then what was the last
I
one?
was trying to remember the last one, and I can't think of it.
I think the last one was just supporting COPD research. So, like, for example, COPD is the 4th leading cause of death in the United States, and it's 176th on funding for the NIH. So that's a great, huge disparity. So we want that to be up higher for more funding. Hopefully you that now.
Oh, sorry.
So it can be as much or as little as you want. It could be, you want to go on the website and interact with people and say, this is what I'm going through. Maybe you can help them or they can help you with something you're going through that's new. Or you can just do the action alert items, or you can go to the meetings, or you can do none of it. And if you want to just get the emails from them and see what they've got to say, that's also really good. So as much or as little as you want to do. Yeah. Okay, done. Any questions? Okay, done. Just gonna start again.
All right, awesome, thank you. Okay, so as you have heard so far, one of the biggest things that we do in the Captain's program is lung health advocacy. It is part of our mission at the COPD Foundation, and it is something that not only do our staff members and lobbyists and researchers and people like myself do for the foundation, but it's something that our grassroots teams of the Captain's program really focus a lot of their time and energy on and lend their voice to the policy priorities that we go forward to try to advocate for. So what is advocacy? You probably hear this word a lot. It is a little bit of a buzzword, but at its very core, all it is the act of supporting something. And that something can be a cause or it can be a proposal like a bill or a piece of legislation. Advocates speak in favor of something, they argue in favor of something, they can support or defend this, and they can plead on behalf of others for this cause. So all it is supporting something strongly in a organized and unified and very intentional fashion. We will get a little bit into how the COPD Foundation advocates for lung health. But because it is Martin Luther King Jr. Day, I really wanted to take a moment to honor the advocacy efforts that have come before us today. I think that one of the best things about America is the opportunity for people like you and me to really have access to our leaders and representatives and senators and tell them what's important to me or you or my family or my community and how that this country can work better to support all of Americans and not just the people currently in charge. Just to jog everyone's memory a little bit, advocacy can look like some very basic things that we enjoy today. Some famous advocacy efforts that have preceded us today is the women's suffrage movement. This actually took over 40 years to pass the right to vote for women. The suffrage movement was officially, the amendment was introduced to Congress in 1878. Before that, it was a social movement for about 50 years to get the traction to get a bill to introduce to Congress. And then this amendment took over 40 years to pass when it finally passed as the 19th Amendment in 1920. Which is just a wonderful example of how much time and effort and energy it takes to have an advocacy movement, because these things that we enjoy today as a given really took over 100 years to get into the foundation of our society as we know of America. Next, I have a great picture of Martin Luther King Jr. In one of his civil rights marches. The civil rights movement led to the passage of the Civil Rights Act of 1964, and Martin Luther King Jr. really spearheaded the movement of nonviolent protest, which led to the Civil Rights Act, prohibiting discrimination on the basis of race, color, religion, sex, or national origin. Another famous civil rights movement is the LGBT rights movement. This is another rights movement that has been going on for about 100 years in the United States. This is an ongoing rights movement that has led to several different policy adoptions and repeals, such as the inclusion of same-sex partners with life benefits, advocacy for public health intervention during the AIDS epidemic, the enactment and then later repeal of the Don't Ask, Don't Tell law, and then the federal legalization of same-sex marriage in 2015. On the very right is something that I think is just such a powerful visual. This is the disability rights movement, and this particular photo is from the Capitol Crawl. And this was an advocacy movement. This specific day saw over 60 protesters arriving to the steps of the Capitol and foregoing their mobility devices and literally crawling up the steps of the Capitol to protest the inaccessibility of several places like this at the Capitol and all over the United States, which led to the adoption of the Americans with Disabilities Act. These are very powerful images. I am very proud of our ability to demonstrate here in the United States. And advocacy is something that I'm very proud to participate in a professional means, and it makes me very happy to lead our captains program. We will get into a little bit more about the policies that the captains program does advocate for, but seeing as it is Martin Luther King Jr. Day, I found this really great video of civil rights turning points throughout the past century in the United States that I'd like to share with you all now.
For the American.
All right. So that was a little bit of a silly video, but I thought that it was a really good way to kind of just level set for the importance of advocacy, and something that I want you all to take away from that very quick overview of the last century of American politics is the grassroots components to a lot of these civil rights bills. So what we do at the COPD Foundation and in the Captains Program is grassroots. And that means that the people who are advocating for these bills and these policies to be adopted are people who are going to be affected by what comes out of these bills. And grassroots is so important for people to understand what it's like to live your life and how things are affecting you that other people might not understand. So at the foundation, I'm very proud to be our captain's coordinator and help to lead our advocacy effort. It is definitely a team effort and a lot goes into it. But we amplify the voices of individuals and give their message a stronger impact by empowering the voice of those who have been historically marginalized. And we try to drive change by creating awareness, influencing policies, and providing a collective voice to the COPD Foundation community. Specifically, patient advocacy is extremely important in the United States because patient healthcare is controlled by several different systems, such as hospitals, insurance providers, pharmaceutical companies, and regulatory agencies like the FDA, and all of these have their own policies and restrictions that could intentionally or unintentionally influence the quality of care that the patients receive. So it's very important as patient advocates to be involved in this type of grassroots movements. All right, so why is it important to advocate for COPD? COPD is currently the 6th leading cause of death in the United States and the 3rd leading cause of death worldwide. It was the 4th leading cause of death just a couple of years ago, but COVID-19 deaths and opiate overdose deaths took the 5th and 4th place out from under COPD. The death rate of COPD hasn't decreased at all. It's just that other things are proving to be more deadly. And an estimated 6.5% of adults in the United States have been diagnosed with COPD, and it is estimated that over 30 million Americans are affected by COPD. In Idaho alone, $120 million is spent annually to treat COPD. Almost 60,000 individuals have been diagnosed with COPD, and those who make less than $15,000 annually are 5 times as likely to be diagnosed with COPD. COPD is highly stigmatized. There is a very low general awareness of what COPD is among the United States, and the comorbidities of things like poverty and like rural living make it much harder to treat COPD and prove that those who already are marginalized are more likely to be diagnosed with COPD. So tying it back into the grassroots component of advocacy, it is extremely important for those who are affected by chronic lung conditions to have a voice and to have a collective response to some of the policies and practices that affect those who have lung conditions and make sure that their best interests are being represented. Okay, so what are we doing about it? So as you know, the Captain's Program is our constant year-round program at the foundation where lung health advocates meet and hear updates about our policy priorities. And then we do advocate and meet with our legislators and send them messages year-round. But every year we do something at the foundation called Impact Lung Health. And what this is our annual legislative advocacy campaign that is designed to engage our congressmen and senators to get them to support our policy priorities to improve the lives of those affected by COPD, bronchiectasis, and NTM lung disease. So for the past 2 years, we're doing it again this March, and we did it last March as well. We are traveling in person to Washington, D.C. with COPD Foundation staff and some of our captains to meet with our senators, get training on our policy priorities, have a good time together, and strengthen those community bonds to make our voices heard for those affected by lung disease. Both Audrey and Kathleen joined us for Impacts 2024. I am sure you can take a picture here somewhere, but I know that you guys can't see that very well. Audrey and Kathleen, if you would like to share a little bit about your experience at Impact, I would welcome you to. If you would not like to, that is completely fine.
Yep,
I'll pause for a moment in case you'd like to share.
Yeah, Impact is really cool because it's in DC, but we're meeting with our Congress people, and so you have their full attention, or at least the attention of their staff.
Yes.
So Kathleen and I went last year, and it was really empowering and impactful because, me coming as a respiratory therapist and an educator, and Kathleen coming as a patient living, with these issues that we're asking for them to support. And the best part of it is, I think that it's nonpartisan. So it doesn't matter what your political views are. you can go and say, hey, we need to have more funding for lung health research so we can diagnose early, so people, live longer and healthier, better quality lives, and it's super easy to talk about. So that's in DC. It's open for people to, it's open for people to come. If you wanted to come to DC, you would just talk to Bailey, and I can get you her email address.
There's
again.
also an application online at COPD Foundation.
Yeah, there is an application online, and it's open right now for the 2025, which is first week of March.
Yep.
So we're both going again.
Yep.
And if anybody else wanted to come, we'd love to have you join us to talk to the Idaho people. They're nice. It's a little scary at first, but you get, then you get all jazzed up.
And after you do it the first time, it gets easier.
Yeah.
So I didn't talk to him just up there. I talked to him afterwards, when they have their town meetings and stuff like that, to set appointments. I didn't always get to talk with them again. I was talking to the staff members. But I know every time they hear something like that, it makes a difference. It can make a difference in how they're going to vote, how they view it, the level of importance. All that matters. It just matters.
Yeah, the more times we put it in front of their face,
Yes.
the more likely they're going to say, oh, I remember the SOAR Act. Yeah, let's make sure everybody has access to oxygen. It's like,
And I'm just going to make a brief statement here because it's not just having access to oxygen. It's the difference between somebody dropping off a big tank so that you can stay in your home and just walk around your home and do nothing else because you don't have the right equipment to go out and live your most full life.
yeah,
And right now, there are a lot of people that are only getting one big tank of oxygen, and they get to use that hose and stay in their house. But they can't go to their church. They can't go see their grandkids. Everybody has to come see them. That's what the SOAR Act specifically addresses in many ways.
Do you feel like a lot of those people don't have the knowledge to know that they can get portable ones?
They don't have to. This is the difference. Once Medicare went, this is getting in the bushes, but Medicare, there was a change done, and so any of the local oxygen providers, and here in this area, you've got Norco and a bunch of other ones, all they had to do was guarantee at a certain price that they would provide oxygen. Well, guess what's the easiest way to provide oxygen?
Well, the big ones.
One big tank.
Correct.
There are other ones that don't have portable oxygen at all. There are, in different parts of the country, that there are none of them are providing portable oxygen.
it's literally anchored to your home.
You literally are anchored to your home.
Okay, I'm gonna use Norco.
Okay,
So I get a prescription from my doctor, and Norco can fill that for us
right,
with insurance. So
yes.
you're saying in other places they don't have,
If they
Places
only
like
have Medicare,
Norco.
and it's not Part D, if they only have Medicare.
gotcha. So you have to have Part D, which I.
Yep, exactly. And I have Part D too, so if and when I ever need oxygen,
But
I would have that
But
opportunity.
do the people realize that they have to have Part D?
No, they don't. People don't realize that. They don't realize that.
So
And
who's telling the people that live in Timbuktu that they can?
And it's not actually just Medicare,
Partly.
it's people that are on Medicaid
Right.
as well.
Yeah.
Yes, absolutely.
So,
Thank you.
that's part of the problem is you don't know until you're in the middle of, you're in the thick of it and you get an admission and then all of a sudden you need oxygen and you don't have access to it because of the way it's set up. So the SOAR Act wants to change the way that oxygen is provided from the
Yeah,
top
I
down.
get that, but I still think of the people that live in Fairfield.
Yeah,
Are they aware that they got Part D? The insurance company would help them get that portable oxygen?
I think if they have Part D and then they need oxygen, whoever's setting it up, the case manager is gonna know that and be able to address that and get it for them. But if they don't have Part D and they need oxygen, they get in a bind. In some places, they have to rent oxygen monthly until they can update their insurance to the right.
Well, we even rent oxygen from Norco, we pay.
But it's
$20 or so a month.
but that's with your insurance.
Right.
Yeah, the cash price is way higher.
Well, I know that, yeah.
Yeah. So it's just changing the way that it's billed and changing the way that it's available. And in
And
this,
if if you're younger, if you're too young to have Medicare, when you have Medicaid,
Right.
that's the only option. You
What
don't
about
have a
Blue
Part
Cross?
B
Does Blue
option.
Cross cover some of that, or
It depends on
some
the
of those other
plan,
insurance?
because I know my mom, actually, before she was Medicare, she was on Medicaid. And then she turned obviously 65, so now she has Blue Cross and then CP. She is on oxygen and has been for a very long time. And we had to fight for her to get the oxygen. And the doctor actually 20 years ago had to write it in a certain way
A letter of medical necessity.
that is on the border of legit, not legit.
Yeah, you have to make it sound like if you don't do this, they're gonna die, and it's gonna be your fault.
Because.
I mean, it's honestly true, but yeah.
Yeah, you
Even
gotta
now,
just have a
she
limit
has
for
a-
that, so.
She has a concentrator.
I didn't
She
either.
has.
No, I don't, when I found out, I was like,
out of the that she can have it, but it was a fight even
Yeah.
to get her the portable oxygen
Yeah,
for her to be able to do that. And the tanks are still this big,
yeah.
so for like her, somebody, she can't carry it.
She can't carry it, and she typically gets around in a wheelchair, right?
Oh, yeah, she's.
So that's like you're trying to wheel yourself and have the tank, or maybe you're trying to push her and the tank. It's a nightmare.
Well, and she has that power scooter, but she can't even do a wheelchair anymore. But
Yeah,
even with that, like, to try to hold like a big,
yeah.
portable one that's
Yeah.
this big, she can't do that. She hasn't been able to do that. for
the
20 years.
insurance won't pay for an Imogen or something like that, a small one?
That's why this is so important. I'm glad that this, and we're very, very lucky in this area to have Norco, to have liquid oxygen, because liquid oxygen is really versatile, and it can help you to be more active and out in the community, because you can have those little buddy tanks, right? But
I had to fight for it
yeah.
with my pulmonologist
Oh, really? Yeah, that's,
to get Norco to provide it.
okay. I was like, wait a minute.
Yet another.
Yeah, but we're lucky in this area that they have liquid oxygen, but that is going away. Most of the rest of the nation does not have access to liquid oxygen. It's concentrator or the tanks, the compressed gas tanks, and that's it.
So that's liquid oxygen, except the Imogen.
No, it's like a propane tank that they come and fill once
It's
a
like
week.
those
Once a
little
week.
green ones.
Yeah, and then it that's what they have over in pulmonary rehab, where they have that cart with oxygen, and that's why it's kind of frosty, because it's liquid oxygen. Yeah, it's just
Oh, I should write that one. Sorry.
She said, "Are we ending right at 2? It's 2:04. I think she's gonna just wrap up. I mean, go ahead. I said that we're done.
Okay, awesome. I just got Audrey's text, saying that you guys are done with your description of Impact. Thank you both for going over your experiences at Impact. I was so thrilled to meet you both in person last year, and I'm really looking forward to meeting you again this year. Alrighty, I know that we're at time, so I'm just going to very quickly finish out the rest of my slides, which are just an overview of our policy priorities here at the foundation. So really quickly, we have 5 policy priorities that are informed by our Advocacy and Public Policy Committee and our board. And this is increased funding in lung health research, patient-focused drug development, access to oxygen therapy, access to pulmonary rehab, and stronger regulation of nicotine products. This is a lot of information about what we specifically advocate for at things like Impact and throughout our captain's program throughout the year. So this is about why we need to increase funding for lung health research. It is severely underfunded compared to the mortality of COPD in the United States. That is a very large and easily accessed talking point for our advocates. Patient-focused drug development is, in a nutshell, giving the FDA and other regulatory agencies things that patients care about as what they want the drugs to actually do. So it is kind of like intuitive to think that, oh, well, patients don't want to cough as much, or they want to sleep through the night without having to get up and expel their mucus. But that is not something that necessarily the FDA looks for drugs to do specifically. So what our pivot program does is to quantify what patients need from their drugs, like improving their cough, improving their sleep, improving how they feel, and giving that to the FDA to allow them to move forward with clinical trials for drugs that are going to treat these symptoms. Supplemental oxygen access has been a big one in 2024. In a nutshell, there is a bit of a kerfluffle in the supplemental oxygen industry, specifically in Medicare, due to Medicare not reimbursing supplemental oxygen enough, to the point where the private industry that was making supplemental oxygen have begun to pull out. There's just not enough supplemental oxygen available, and it's making it very hard for patients to access. So we had a bill this year that would allow for the oxygen to be patient-centric and to be adequately reimbursed by Medicare, among a bunch of other things that our bill didn't pass, unfortunately, but it was the first year that the bill was in front of Congress, and it got dozens and dozens of co-sponsors and was very popular on a bipartisan basis. So we're still pretty happy about that. We're hoping that it is reintroduced this year and that we will continue to advocate for it. We also found an awareness effort to World Oxygen Day, which is celebrated annually on October the 2nd, 2002. Over here is one of our captains, Tom, and his wife, Wendy, with their RT, Jenny, at their local health clinic, sharing some information on World Oxygen Day. So this is that awareness part of our advocacy that our captains do. Pulmonary rehab is something that we advocate for. Pulmonary rehab has been proven to improve outcomes for people with COPD and other lung health conditions. However, with the ending of the public health COVID emergency a couple of years ago, they failed to extend Medicare coverage of virtual pulmonary rehab, so like telehealth rehab. And this is what we call a glitch bill. It is something that we believe was overlooked and was not intentional to not be extended. So we've been advocating to get this re-extended through Medicare. This again is not something that passed in 2024, but we're hoping that it is reintroduced and something that we can continue to advocate for. We are a member of the World Health Organization's World Rehab Association, and this is a group of international stakeholders, not just from the respiratory field, but from all sorts of medical backgrounds, to focus on raising awareness for the importance of rehab and creating a global demand for rehab. One of the last things on our policy priorities is nicotine device regulation. We partner very frequently with Tobacco-Free Kids to assist with their initiatives, specifically for the proposed menthol cigarette ban. And we also endorse the bipartisan congressional caucus to end the youth vaping epidemic. Other advocacy areas is we do have specific bronchiectasis and NTM advocacy. Recently, we were a proponent of the PASTEUR Act, which is an act to jumpstart the development of new antimicrobial drugs to fight drug-resistant bacteria. So when you hear of antibiotics becoming less effective because bacteria is ever evolving and evolving around the current antibiotics that we have, this bill would intervene there. And then like World Oxygen Day, we also have a World Bronchiectasis Day, which is celebrated annually on July 1st. So we do awareness activities with that, similar to World Oxygen Day. We also do COPD awareness each fall. In November, we have Lace Up for Lungs. November is COPD Awareness Month, and World COPD Day always falls in November. So we do community events, we raise awareness, raise funds, we share pictures of us getting involved. This is a picture of my dog with some laces around his legs. He looks really scary in this picture, I promise you, he's sweet. And that is an overview of our policy priorities and how we advocate. I am just so thrilled to be able to join the Better Breathers Club today, virtually, to tell you all about the COPD Foundation. I hope that you have a better understanding of all of the ways that we help the COPD and lung health community, and all of the ways that you can use our resources and get involved if you so choose. So just to recap, if you want to get involved with the foundation, you can join our captain's program. You can visit our website and explore our resources. You can join our social programs on COPD 360 Social and Broken and TM 360 Social. And you can talk to one of our peer health coaches if you have a specific question about your lung conditions that you aren't able to get other resources from just visiting our website alone. And with that, I would love for you to reach out to me with any specific questions, or so that I can assist with any ways that you can get involved with the foundation. Thank you all so much for chatting with me today. I will go ahead and pause for some questions. I know that we are over time and I can't hear you, so if you have any specific questions, please let Audrey know, and I'm sure that she'd be happy to share them with me. And if not, I just really want to thank you all again for your time today. It's been wonderful to share about the foundation with you.
Cool.
Appreciate it.
I'm gonna tell you, you got claps and claps and thank yous. Any questions, anybody? No? No questions.
All right, Audrey says no questions. Thank you. Well, thank you all so much again. I sincerely appreciate being able to share with you all about something of my passion project in my career at the foundation. I absolutely love working for the foundation, and Audrey and Kathleen are fantastic captains. And I hope that if you all have any aspirations of joining them, you feel free to reach out to me. Well, thank you again. I will make sure that you all get these slides in my email if you ever want to reach out. But I hope everyone has a fantastic rest of their day and the rest of 2025. Happy Martin Luther King Jr. Day and happy Inauguration Day. And I will chat with you all in the future. Thank you.
Yeah, I told her, she said, thank